Well, let's shift focus now to Mumbai, financial capital of India. It continues to be a major hotspot of coronavirus cases. Now, in the last 24 hours, Mumbai has recorded 357 new positive cases, including 11 deaths, and the total tally now going up to 4,589. The death toll in the city has gone up to 179 at this point in time. And the biggest challenge continues to be the Dharavi slum area in Mumbai, which is extremely crowded, and a number of cases of coronavirus emerging from there. Let me go across to Disha, who's joining us for more details. Disha, Mumbai is a major hotspot of the coronavirus at this point in time, very hard hit. But the biggest challenge here continues to be Dharavi, and there is still confusion, in terms of how exactly it needs to be handled. Take us through what you know.
Well, absolutely, Avni. Definitely, in the state of Maharashtra, Mumbai is the center focus at this point in time. And within Mumbai, if you talk about Dharavi, the largest area, of course, with a spread over 2 kilometers, that remains to be the biggest challenge for the BMC authorities. What we know for the fact that almost 10 days ago, the BMC inside Dharavi itself, they had started door-to-door thermal screening. And today, as we speak, about 47,500 people have been screened so far, is what we understand. And out of that, 500 swabs have been sent for testing purposes. Nearly 500 swabs have been sent for testing purposes. So this is, of course, like we are talking about that how rapidly the testing has increased inside Dharavi, because remember, it is one such area which has a lot of slums. It is congested. More than 5 to 6 family members stay in one family. So that is why social distancing is next to impossible here. In fact, another important development also, that what we know that yesterday a team from the center had also visited Dharavi and 2 other slums. But of course, in Dharavi, they have suggested certain measures to the BMC. First and foremost, of course, that they should have a portable, toilets here in concern, so that this will augment the community toilets aspect. Because remember, Avni, in Dharavi, 80% of the population, they use common public toilet. They have to step out of their homes to, for this purpose, and that is why having portable toilets is one of the suggestions, is what we understand. The second suggestion says that you have to increase the testing capacity. Remember, on an average, at least every day, over and above 1,000 to 1,500 samples are being tested every day. But now there are being suggestions that that should also increase, so that people can be detected at an early stage and that can contain the spread of the virus.
Right.
So these are certain suggestions that have been, suggested by the center to the BMC. We'll have to wait per se as to what really happens on the ground level.
Right, absolutely, Disha. And the other aspect, of course, is that what are the measures that are being taken right now in terms of surveillance of the Dharavi area, in terms of the screening and perhaps quarantining people who have been in contact with all those who have tested positive?
Well, inside Dharavi, if we talk about, Avni, there is one institutional quarantine center that has been set up by the BMC with in Dharavi Sports Complex, where so far what we know, the estimate figure is that over and above, at least there are 200 to 300 people who have been institutionally quarantined. The aspect of institutional quarantine is such that people who live in slums, if they need to be quarantined, it is not possible, because they there are a lot of people staying in one family. So that is why they are kept away from the families. That is called as institutional quarantine. If you talk about SRA buildings, except for that, there are about 150 to 200 people who have been home quarantined. So these are certain measures that have been taken on the ground level. As far as the containment zones are identified, there are over and above 100 containment zones that have been identified in Dharavi alone, which essentially means people's movement have been completely restricted there. They do not even have to step out to buy essentials. BMC is providing everything door to door to them as per their daily requirement and need. Apart from this, lastly, drones are also being used, Avni, because remember, like how I was talking about that it is congested area, slum area. It is impossible for BMC to be everywhere. So that is why drones are being used to capture people's movement. And if at all, if they find any violators or people not taking the lockdown measures seriously, then action is also being taken.
All right, Disha, thanks so much for joining us with all of those details. So Dharavi area in Mumbai is still posing to be a significant challenge. Let's in fact